have cervical cancer. Now, in the country, cervical cancer is the second most popular cancer, right. And also, and this is because 33 out of every 100,000 people suffer from cervical cancer or live with it, but also 22 out of every 100,000 people die from cancer every year, making it die from cervical cancer specifically every year, making it one of, I think it's the second largest killer cancer in Kenya, right. Especially for women. So when you look at those statistics, then clearly cervical cancer is a topic that needs to be discussed, owing to the fact that it's also very preventable, that will come to probably at a later point. Right. But when coming to the risk factors, some of the risk factors for cervical cancer, really the biggest risk factor is the HPV virus, right. Which comes as a having unprotected sex, and so it's really sexually transmitted, the HPV virus, and especially the strains HPV 16 and HPV 18 right. are the ones that lead to cervical cancer. More than that, we have tobacco smoking. Mm-hmm. Use of tobacco really brings in a lot of carcinogens in the body, which could create cervical cancer. Unhealthy eating, sedentary living, and also exposure to carcinogens, which could also lead to cervical cancer.
Right. Now, it is also noteworthy that cases of cervical cancer are on the rising trajectory in the country. What could be the contributing factors for this? Why are we having so many cases lately?
Yeah, so there are many reasons actually that contribute to us having many cases of cervical cancer, and really I'd go back to the HPV and the fact that we are just beginning to get screening ongoing for HPV and sort of make it nationalized. So before that happens, then as people have more unprotected sex, then a lot of HPV continues to transfer and the cases continue to be on the rise.
Right.
But also the other thing has to do with the taking of hormonal pills. There are some hormones that really interfere about sedentary living as well, and healthy diets, but also those are so what applies to the people. But also when you look at the healthcare system as it is at the moment, it's not designed or it's not strong enough to be able to handle a screening for people with cervical cancer. So a lot of people continue to live their lives without knowing where they stay, right. And so the healthcare system as well, and in its weakness, contributes to the rising cases of cervical cancer.
Right. Mm-hmm. Now, talking about cancer screening, how often should one consider going for the screening?
So for cervical cancer, screening starts as early as 21. Mm-hmm. So between 21 to 29, you could have the HPV, the pap smear screening, and that is for 3 years, after every 3 years. But once you get to 30, and between 30 and 65, then you can get the combined HPV screening and the pap smear screening every 5 years, or maintain the HPV, the pap smear screening, for 3 years consecutively. So there is those two sort of dimensions, but generally after every 3 years, one should be getting screened either through pap smear or HPV screening.
Right. Now let's talk about the preventive measures, because you said that cervical cancer is one of the preventive one of cancer strains that can be prevented. Now talking about the preventive measure of the HPV vaccine, how is the uptake in the country, considering that when it was introduced there was a lot of misinformation, disinformation about the disease, about the vaccine?
Yeah, so when you look at the statistics, statistics actually indicate that between 2019 and 2020, there has been a rise actually in HPV uptake, though it's still very low because it was at around 19 in 2019, and now we are at around 33% uptake. Clearly there's an increase, but it's still very low. And the reason why it's very low is also very interesting, because there's multiple research that was taken to look at why were people against the HPV vaccination.
Right.
And some of the findings there were very interesting in the sense that one of the reasons why people did not go is because they felt that they were not as informed about the vaccine. And in fact, the research goes ahead to conclude that the reason why the ones who went to get the vaccine went is because they felt adequately educated on the vaccination. So clearly there was an education gap there, and with a lot of misinformation and disinformation, there was not a lot of space for the right information to pave through. So that bubble then led to the slow uptake of cervical cancer. But also the other thing is, especially when you look at it through a gender equality lens, then you come to realize that in many communities, men still have authority over women, especially even on their health. And so in some communities, and this is also backed up by research, is they found out that men had made decisions on behalf of the women. So if the man says that you're not going to get the vaccination, then you're not going to get the vaccination. And so those challenges as well when it comes to gender equality also led to the slow uptake of the cervical the HPV vaccine. Yeah.
Now, when you're talking about the transmission of the cervical cancer through the HPV, the virus. Now, you said this virus is sexually transmitted. Is there probably something that has been done to contain the spread of this virus? Because the vaccine is given to the female, but then the male counterparts also spread this virus. So, is there something that has been done to counter the spread for the men?
So ideally, men could also take the vaccine. So that is what part of the information that is mostly not out there. But ideally, men are also supposed to take vaccine. Female only take it because then it's a high priority for them to actually take it. So that is one thing. But also the other thing is practicing safe sexual behavior. So sticking to one partner, using protective condoms, for instance, and just being having practiced safe sexual behavior for men, then could use that as a way to be able to not transmit as much of the HPV. So those are some of the mitigations that are currently in place. But also because the risk is high on the women's side, then the current priorities are set to first get the women, vaccinated, and then the men will follow, or other interventions will come in for men.
Now, most interesting, what we really want to know, what is the role of young people when it comes to fighting, curbing the burden of cervical cancer in the country?
So young people have, and especially in this age, a very critical role in fighting cervical cancer. And I'll sort of break this down into three. So one is young people have to be educated, about cervical cancer. They have to be knowledgeable about this disease in a way that then they are able to spread the right information and counter the misinformation, which is the second thing. Young people could act as advocates, and use their voices through mainstream media, social media, communities, clubs that they are in, to be able to share the right information on cervical cancer. But also the third thing is young people are agents of change. So through advocacy to really champion for things like improved cervical cancer screenings or reduced cost of these screenings, for example, and vaccinations, then they're able to be a voice to be able to push governments to then enable people to get these screenings. But also lastly, I think as young people being advocates of change, then the thing would also be that young people have to be actively engaged in research, knowing, going to the communities, being either participants of the research or the ones who carry out the research, then to be able to bolster the evidence, to be able then to contribute to the body of work that leads to better cervical health.
Now, the WHO reports indicate that over 1 million women worldwide are living with cervical cancer, and many of whom have no access to health care services for the prevention, curative, and the palliative care. In terms of policy, do you think the Kenyan government has done enough to cover some of these challenges that are being faced by people who are living with cervical cancer?
So Kenya has, and this has been a question that has been in discussion for a very long time, and until very recently in 2019, we started to see some progress. So, for example, we have the Kenya Cancer Policy for 2019
to 2030.
Yes, and also we have the cervical cancer screening guidelines that were just developed recently. So clearly there has been action towards that front, and that is actually some of the things that then led to HPV vaccination start happening. But now, at the moment, we can't really judge on that because these policies are very young. They are less than 3 years now, so they are just beginning to get implemented. And so I guess the thing is, we'll wait to see if they really get implemented and if they really get to do what they say, because they are very beautiful policies that if implemented correctly, then you could see a huge transition in the cervical cancer space. But also, having said that, the other thing is that especially when it concerns policy, what we'd like to see more is, for example, cervical cancer screenings, the pap smear and the HPV screenings are still charged, and for most people, they cannot be able to afford this cost, and this prevents them from accessing these services. Sure. So we'd want to see a reduction in these costs. And also the other thing is, we'd want to see better service delivery, getting cervical screening to the villages, to the rural areas. As we know, most of these screenings are primarily in urban centers and towns and not really, reaching people at the last mile communities. So that is, some of the things that as the policy begins to get implemented, we'll be interested in seeing how those are also being made to ensure that we are able to reduce on this burden.
Right. Now, maybe let me just narrow down to your organization, that is Starlink INC, because you are mainly focused on the non-communicable diseases, creating awareness and arming people with information on NCDs. Maybe what I'd want to know is what are the good tidings you people are having for cervical cancer, and probably you could tell us about any events that you're planning, because you are in the month of awareness on cervical health.
Yeah, so for Starlink, we've done actually quite a lot when it comes to cervical health and the NCD space in general. So maybe just to mention them in bullet points. So one is we've been able to now educate over 3.4 million people in 10 countries with information on cervical cancer under a project that we are calling NCD 365 that is currently ongoing. And in fact, as of today, we are starting a podcast series and a web series to be able to bring out the voices of people living with these diseases and to share them publicly so that other people see that actually there are people living with these diseases and this is not just things that are being talked about, and to hear their survival stories and how they were able to cope with it. So that is the other thing that we are currently doing. But also in terms of tangible impact that also we've had in the country is, for example, throughout 2020, we partnered with the NCD Alliance of Kenya and the Vihiga County government, and we're able to really take health education on cervical cancer and other non-communicable diseases right into the villages, and formed groups with people living with these diseases to be able to educate them, but also to empower them. But also the other thing that we're able to do is to work with 4 health centers and clinics in the county and sort of enhance and bolster their ability to be able to provide the health education on cervical cancer and other non-communicable diseases, but also to be able to conduct health screenings. So those are some of the things that we've been able to do in the past. What we are currently doing this month for cervical screening is that we are partnering with various organizations to be able to do an awareness campaign, and that is coming probably in the 3rd week of the month. But also, we've already released our mobile application NCD 365 on Play Store. It's available for free, and people can be able to go and learn about cervical health there and connect with organizations that provide services in the space. But also we have an online course, NCDs for Public Health, on Udemy, where people can also go and learn and actually get certified that they've learned about these diseases and that they're able to now talk about it. Yeah.
Now, very impressive. Probably if there's someone would want to, get to learn in person, where do they get the links of where you people are located on what you people are doing? Because it's very impressive to hear what you people have done on NCDs.
Yeah. So in terms of if people want to sort of right now, we are not very much working in the physical space, but we are located in Upper Hill, in Nairobi. So our website is where you can find us easily at www.stoylink.com, and that goes for all of our social media on Facebook, Stoylink, on Instagram, on LinkedIn, and we have a very active social media platform. So as soon as you text us, we are able to get back to you with this information. But also, we already have a lot of courses developed online on uncommunicable diseases, like the NCD for public health, that you are able to take and learn for free now. So we have this, we have sponsored 1,000 free spaces. We have 700 of them already taken. So we have 300 more spaces for people to join in and learn about these diseases for free.
Right.
And so, and that is self-paced, and you can learn from wherever you are in the country, making it more accessible to more people. So those are some of the ways that you are able to reach us and interact with our content, but primarily on our website, www.stoylink.com, and on all social media platforms as well.
Right.
Yeah.
Now, probably as we wind up, what could be your final message to the general populace concerning the cervical cancer, cervical health awareness month that we are in? What message can you be having for the general populace?
All right, so I want to look at them directly. Where do I look? Yeah, so this is the message for Cervical Cancer Month for 2022. And the message is cervical cancer is here with us. Cervical cancer is very real. It's not a myth. And in line with the theme for 2022, for cervical cancer especially, is go get tested, go get screened for cervical cancer, get the vaccination if you need to, and if we meet the barriers for getting vaccination, and stay healthy. So go get screened, go get tested, get vaccinated, and stay healthy. And that would be the main theme for cervical cancer, especially for this month, but also running throughout the year.
Right.
Yeah.
Maybe in as much as, yes, we're winding up this, you've really measured on the theme of getting tested, getting screened. Where can you refer people to, where they can readily get these services? Because I know when people are not getting screened because they probably don't know where they can seek these services.
Yeah, so right now a lot of screening is happening in level 3 and level 4 hospitals mostly. But if you're in Nairobi, there's a lot of screening that is going to be happening on site. So I know, for example, there are campaigns already that are being worked on, and you'll be able to see that on our various social media platforms, where we'll be visiting various slum areas in Nairobi, but also various communities, and getting those screenings happening, and also linking them then to the hospitals and the facilities that we are going to partner with. So those plans are underway to get people screened. But in the event that you just need to walk into a facility and go get screened, from the district hospital, you can get these screening services, and then you can move upwards. So screening is now being made more available as the policies continue to get implemented, and so you should be able to get screened really by just walking into most of these district hospitals.
All right. Thank you so much, Stephen, for that information. It's very insightful and it's very educative. We hope to have you here across the month, as we are also in the month awareness of cervical health. Thank you so much for your time.
Thank you so much for having me and for really taking lead in speaking about cervical cancer. Thank you very much.
Right. Now, with that, we're taking another very short break here on KUTV Primetime News. We still have much for you, so keep it right.